Welcome everyone to the Near Me for Mental Health Services virtual learning session hosted by Michelle Miller. My name's Angela and I'm the event manager. During the presentation, your lines will remain on listen only. If you require assistance at any time, please key star then 0 on your telephone and a coordinator will be happy to assist you. I'd like to advise all parties that the conference is being recorded, and now I'd like to hand over to Michelle. Please go ahead.
Thank you. Can you pass on to the next slide, please? So thank you everyone for joining the webinar today. We're delighted with such a great interest. I think we had about 218 expressions of interest in this webinar, and so far we've got 87 have joined the call today. So I think it just shows the level of interest that we have of Near Me within mental health services across Scotland. Next slide. So your phone lines will be muted during the presentation, but there will be an opportunity to ask questions throughout the slides today. So if you have any questions you'd like to ask, you can pop them in the chat box, and we will be unmuting lines at the very end of the webinar should anyone want to pose a question towards the end. And that's just how you can access the chat box. It's a small bubble, and then you just click on that, and then you will see the chat on the right-hand side. And April Maslin, who's on the call today, is going to keep an eye on the chat and pose some questions as we work through the presentations today. Next slide. So this is the agenda for today's session. I'm Michelle Miller. I'm the portfolio lead for the Mental Health Improvement portfolio at Healthcare Improvement Scotland, and I'm delighted to be joined today on the webinar with Claire Morrison, who's the National Near Me Programme Lead at Scottish Government, and Chris Wright, the National Advisor for Digital Mental Health at Scottish Government, and we're going to give a bit of some national perspective on this work. We're then going to be joined with colleagues from across Scotland, sharing their direct experience of using Near Me in practice, and they're going to be sharing what's worked well, what have the enablers been, what have some of the challenges been, how have teams overcome those challenges, and what are their top tips. So I've already had a look at the slides, they look great, so we're going to learn lots in the session today. So thank you so much everyone for taking the time to be part of the session today. Next slide. So I just wanted to explain why Healthcare Improvement Scotland we're hosting this webinar alongside our national colleagues, and basically this is to support the accelerated rollout of Near Me across Scotland. There is a larger programme happening, and Claire Morrison and Chris Wright are going to give that national perspective around that. So I'm going to hand over to Claire. I think her title has changed since that slide because she's now the Scottish Government lead for Near Me at Scottish Government. So we'll pass over to Claire.
Thank you very much, and I hope you can hear me all right. I've got you on speakerphone, so I hope that works. Yeah. Next slide, please. So just to give you a really brief overview of the Near Me video consulting programme. So Near Me has been around for a while. It's been in use for a couple of years and probably more used in rural areas than in other locations. So prior to February, across the country, about 300 Near Me calls were being made a week across all specialties. And at the end of February, we were approached and asked, well, how can we scale Near Me up quickly in response to COVID to really enable physical distancing for both patients and for clinicians? And so we embarked on a programme with 3 key steps, looking at the technical setup, so ensuring teams were technically able to use Near Me, looking at the service processes, which is really the bit that's probably the most difficult around how do you embed video consulting into your normal way of providing consultations. And then finally, individual training, and all of that now being available via the Cheer platform. And over the last 8 weeks, we've moved to so the data for the last week of April, where there were 10,700 calls a week. So you can see a really significant growth in the number of consultations during that 8-week period. Next slide, please. So in terms of going forward, our vision for Near Me in the future is that all health and care consultations are provided by Near Me whenever it's clinically appropriate. And I do want to stress that. I think it's really important to remember that there are times when actually a telephone would be good enough, and equally there are times when a face-to-face consultation is needed. So it's about clinicians using Near Me whenever it's appropriate. And the reasons for that are threefold. So firstly, to enable physical distancing, and physical distancing will be continuing for many months to come. And that is therefore to protect both the patient and the clinician. Secondly, it's around delivering person-centred and convenient care. So we've known for a long time that some patients find it difficult to attend appointments, and that can be due to travelling difficulties. Perhaps they live in a rural location. Actually, they could live really close to a hospital and find it difficult to attend because they've got something like a caring responsibility at home, making it difficult to leave home, or there could be transport difficulties, many different barriers to attending. And probably a key one that perhaps we haven't picked up on that much historically is work, and employers actually not allowing people time off to attend appointments, and the stigma attached with attending appointments all the time. So lots of reasons why Near Me can deliver more person-centred care. And finally, we have to recognise the environmental impact of every journey. So every journey has a carbon footprint, and Near Me is a way that to reduce that carbon footprint of NHS services. So that's our vision for Near Me going forward, and I'll now hand back to Michelle. Thank you very much.
Thank you. Next slide. So we'll now hand over to Chris, who's the National Advisor for Digital Mental Health at Scottish Government. Thanks, Chris.
Okay, thanks, Michelle. Thanks very much. So I'm here just to give you a wee bit of a context around digital mental health, and really where Near Me sits within a wider programme of work around the implementation of technologically enabled care within the mental health structure. So my work really consists of 5 key work streams. We work across a thing called digital therapy, which looks at things like CTBT, internet-enabled CBT, and a range of other technologies that can be used in conjunction with face-to-face or as an addition to existing service models. We have work that sits within our self-management and self-care work stream, so this includes things like NHS Inform, interactive self-help guides, but also apps and various other things that we look at on a weekly and daily basis. The third stream is video conferencing. I think it's important to realise that while there's an immediate need for Near Me, this is actually part of a long-term implementation programme. So we've looked at video conferencing for really the last 12 months, 18 months. We've been part of the national programme for Near Me. So really what COVID is giving us is the opportunity to really to accelerate this work and move it forward significantly in the next few months. But it is a long-term aspiration that video conferencing will be added into the suite of digital offerings as we move forward. Underpinning those 3 elements is ongoing evaluation and innovation. So obviously it's very, very important that we're working within an evidence-based approach with the use of digital, and we have a national programme of evaluation which is ongoing across the 3 work streams. And this is primarily looks at not just the clinical effectiveness, but also implementation, patient acceptability, and various other things like organisational readiness as well. Innovation, as you can imagine, within digital is imperative. I think within mental health, we always have an issue balancing evidence versus the speed of innovation. But we're actually taking steps to ensure that the infrastructure is there to allow us to innovate with the appropriate evidence gathering and evaluation ongoing. I think I've stressed at this point that this programme is a partnership. It's not done in isolation. So it's very, very important that we realise that everything we do is a partnership between clinicians, the technical world, the commercial world, and the strategic world. Next slide, please. So what we do is we work within stepped care. So this is the stepped care triangle. As you see, these are a couple of examples of the digital work that we have ongoing. We do have digital self-help, not just on NHS Inform, but across a range of different platforms. We have computerised CBT for depression and anxiety. We now have computerised CBT for long-term conditions and anxiety-related disorders. We also have a thing called internet-enabled CBT, which is written communication, CBT through written communication. Then you can see at the top we have things like video-enabled therapy with Near Me. I would stress at this point what we're really looking to do longer term is to start combining technologies to really offer the most complete service we can. And a good example could be eating disorders, where we have apps such as Recovery Record, which allows patients and clinicians to the weights, for example, of the patients that are coming into to clinics, but this could be delivered through a video enabled service. Next slide. So the big message for me really is that Near Me is part of a larger program of work around digital. We look at the combination of technologies to allow us to best deliver the existing services using technology and enhancing what we do on a daily basis. We have digital therapy services, and we have self-help and self-managed services coming in. I think that the most important aspect of what we do is really gaining the recognition that due to increased demand, not just during COVID, but overall in mental health services, that the integration and use of evidence-based technology is now becoming an absolute part of the solution moving forward and becomes vital to all our work as we move on. And that's all I have to say. Thank you very much.
Thank you so much, Chris. I'm aware that Lynn and Amanda, well, Lynn certainly has to go off really quickly, so we'll just quickly move over to Lynn so that she can do her piece before she's called away shortly. Over to you, Lynn and Amanda.
Hi, good afternoon. So I'm going to start the presentation today, and then Amanda will take over and be joining for the rest of the session. So within NHS Grampian and the CAM service, we've been using Near Me Attend Anywhere for quite some period of time. We had agreed as a service that we were going to be moving to something called WorkSmart, where all the staff could work from different locations and had appropriate IT, which has made using Near Me much easier for us as an organisation. With the onset of COVID-19, Amanda, which you can share more about, has been rolling out that platform to colleagues within mental health and learning disability services, but our recent data shows from CAMS that we had 518 consultations through Attend Anywhere in this last month, which is doubling on the month before due to COVID, and a slightly lower uptake within the mental health and learning disability service. What worked well for us is getting patient engagement and feedback early on at the beginning of the process of using Near Me. We have found that there's been a reduction in missed appointments, and children and young people especially like the platform, and we've had very few people who have not taken up that offer, especially due to the situation with COVID-19. It's also enabled our staff to work more flexibly from home over a 7-day week because they have the IT available. They've been working their hours as they can to flex around childcare, which obviously in the current environment is going to be very important. The key enablers have been finding early adopters and staff within the system who are willing to give this platform a go and test it out with some patients, which consequently resulted in lots of positive feedback, and others felt more comfortable and ready to use that. And as mentioned, certainly the increased IT within the service has made a significant difference. So for us within the CAM service, all staff have laptops with cameras and the IT ready so that they can use that from any location as appropriate. I'll just hand over to Amanda now, who can talk more about the challenges and how we've overcome that and top tips she's found as support manager.
Thanks, Lynn. Thanks for that. So the challenges that we've found throughout this has been the lack of IT equipment. Like Lynn said, within CAMS, we're in a privileged position that we do have the IT equipment available to us, but our colleagues throughout mental health and learning disability services aren't necessarily in that position and haven't been. And so with the influx of IT, we've been trying to request laptops and suitable devices for them to access, but it's just not feasibly possible all of the time. What we have done, however, is we've managed to kind of overcome some of that in different ways to try and make it a little bit more manageable. The other aspect to that is not just the lack of our IT equipment. It could be, and we've experienced that the patients from their end, it's the lack of IT equipment that they might have, or suitable connection, I would probably say, is more feasible. A lot of our patients live rural and remote, and so they've found that bandwidth has been an issue for them in connectivity, and that can sometimes then mean that we struggle to connect to our patients that way. But we've managed to overcome that in lots of different ways by just switching over to telephone consultations. Also, another challenge for us has been encouraging the staff across mental health and learning disability services that it's something new. Obviously, rapidly, we've been going through change the past couple of weeks. And what we've experienced is that for some staff, the change of way of working, whether that's flexibly working from home, or using new equipment has been challenging for some of them. But again, it's just about the appropriate training and teaching available to them. We've overcome some of the challenges, like I'd said, providing the correct IT equipment. Well, we can't always provide laptops with cameras for all of the clinical staff within mental health and learning disability services. So what we have done is that within main bases across Aberdeen, we've set up clinic rooms that have equipment in them, and they're bookable for staff to go and use to do attend anywhere appointments and or any other virtual appointments that they would like to have, whether that's by telephone. And also it's about making it core clinical care, so making the core tasks of clinical care available to our clinical staff. We've been working closely with the local Near Me project team, and they've been working with us to provide us with very helpful and useful links to certain materials, and we've shared with our clinical staff and also with our patients, and it's very clear and easy to understand, which has made the process a lot easier. But top tips from us in Grampian is, I would say that this will probably be our new norm after COVID-19, in that there'll be things that we'll be doing to adopt further and to use the platform a lot more. We also are looking to check in our patients with a virtual receptionist and be able to then at least keep contact with them whilst they're in the waiting room virtually. And it's about managers and leaders being really enthusiastic about the changes and the change that's to come. We've had a lot of patient feedback, and it's been very positive for NHS Grampian. And so we're just going to continue to grow on that and continue to use the platform to its full potential. That's everything from me. Thanks.
That's lovely. Thank you so much, Lynn and Amanda, and great start to the session. We're now going to move over to, is it Rob next? Idris, sorry. It's Idris next. Idris, you have been working, as well as working in NHS Highland, you've been providing support around our clinical guidance with CREST, and I wonder if you want to say something about that as part of your overview as well. Thanks.
Yeah, sure, thank you. Hello everyone, I hope you can all hear me. Again, I'm on hands-free, so let me know if there's any problems. If we could start a slide, that would be great. So we've been asked today to talk about, as you just heard, the areas and types of services that we're delivering. Very fortunate in Highlands that we had input really from the beginning with Claire Morrison trying to set up these clinics across Highlands. And so really for the last 2 years, there's been routine appointments worked in very remote areas. And actually, as part of Claire's work setting up Near Me hubs, that was incredibly useful at trying to overcome some of the challenges that were just described. And I'll talk a little more about that in a moment. We were working on a national policy along with Chris Wright and the tech team, but COVID overtook us to a certain point, and so some of the plans to look at urgent assessments and at-home assessments suddenly became the priority, as everyone's now aware. At home, working from home to home is becoming really probably one of the basis of trying to keep this social distancing going, and some of the challenges that come with that have already been discussed. In particular, on top of that, I would agree with the technology difficulties. So there have been two sides to that. One has been the technology of the staff, and one has been the technology of the patients. I'll explore that in a moment. What I would say has worked quite well, though, is really looking at not only the at-home assessments, but the context of that. So we're looking now at urgent reviews from GPs, for patients at home, urgent reviews from hospitals. So we've been using this almost as a liaison to people who, say, presented in emergency departments who are sitting on the ward after medical review and need urgent psychiatric review without having to attend the general hospital or then have to come over from the general hospital. We're also looking at using this for CPA and CTO reviews. So not only is it enabling us to maintain some of the routine referrals and work, which helps keep the waiting list down in the long term because this is going to last for months, but it's also enabling us to do some of the really urgent crisis assessments and referrals, both under the Mental Health Act and under the legislature. The enablers here have primarily been the staff. There's been a lot of desire to work flexibly and to continue to offer a mental health service. So I think staff across NHS Highland have been really keen to look at how they can keep going with their caseloads and continue to offer appointments. And I think without the national team driving that, so people at tech essentially, I think we wouldn't really have pursued this as far as we could, knowing that there's national teams supporting us and also having the links with our national colleagues, especially after the NHS Lothian rollout and Rob Waller driving that forward as the first area to take this on, I think really helped us know that we weren't doing it on our own. And there's a collective kind of comfort knowing that we're all doing this together and all learning from each other. So that's been incredibly valuable. Some of the staff have said that the quick reference guides, which you alluded to in the introduction, and thank you for that, have been useful. So as part of trying to make that national guidance we were developing more accessible, it was a lengthy document to say the least. We had help in creating some quick reference guides which are available to break down the different parts of it. So if you're going to do at home, what you need to know. If you're going to be doing urgent assessments, what you need to know. And staff have found those quite useful for the targeted areas in which they work. Coming back to some of the challenges I spoke about earlier then, staff technology isn't always available, and we've had difficulties in the Highlands in particular with what's known as our direct access system. So a lot of our laptops have this installed to enable people to access patient records and patient notes from non-NHS Wi-Fi. So you can take your laptop home and access patient records, which is great. But this blocks near me, which is very frustrating. And there were meant to be updates, which hopefully have worked around this, but it's still been a problem. So we've overcome this by looking at a dual screen system. So essentially, IT up here, you have to be very good at getting hold of a lot of iPads which don't access patient records, but which you can use for near me. So we have dual screen setup where you have the patient on one screen using the near me, and then the patient records are available on another screen. And that's also worked well then for people who have desktops rather than laptops in work. And essentially we have a lot of iPads which are bookable, and people can say, actually, I'm going to be running a clinic, I need an iPad. Similarly to Grampian, we have the near-me rooms for clinicians to book as well. So again, thinking of it as booking a clinic room essentially. What we are struggling with still, and I think Grampian, you're not alone with the difficulties in the NHS Highlands with connectivity, is patients often don't have not just the connectivity, but actually the hardware. We found that especially the more deprived patients don't have up-to-date laptops, tablets, things like that, especially for mental health, and we're thinking of certain vulnerable groups as well. And I would highlight that we haven't really overcome this problem yet. I'd be interested to hear other people's thoughts on this, that we are at risk of equity becoming a problem with access to mental health services as we move forwards. Some of the near-me rooms, the hubs we call them that were set up, would be useful in overcoming this when it isn't in a coronavirus setting, but we can't essentially have patients coming to near-me rooms when they have the risk of coronavirus that overcome the whole point of using near-me at home. So we still haven't quite overcome that difficulty yet. What I would say, though, a top tip, two things really. Staff reluctance, despite the enthusiasm for change, there's still a reluctance, and doing small tutorials has been useful. So actually getting a CMHT in their remote locations, or linking in and doing small tutorials with one or two people, then logging in as a patient also helps them understand what's going on, and then you logging in as a patient and them seeing you, just to have the familiarity of the system. That's been really useful. And what we've also done then is created subset waiting rooms. So we initially only had one big psychiatry waiting room, but that very quickly became overwhelmed. So we've broken that down into different CMHTs and different specialties, which has helped coordinate the waiting rooms a bit better. It's also reduced the risk of confidentiality being breached. So I'm not sure if you have been aware of seeing this yet. When people log into near-me, anyone with access to that waiting room can see all the people sitting in that waiting room. And as they're called into, say, a clinic room, they're still sitting in the waiting room. You can still see who they are and who they're seeing. So by having discrete waiting areas with only limited access to that waiting area, depending on the clinician, it limits the risk of breaching that confidentiality across, say, a health board. So that was a point that we learned here. And so far it's going really well. We've now got over 30 waiting areas, over 370 staff registered, and we're running around 200 appointments a week at the moment using this. So it is expanding outwards in the Highlands.
Thank you, Idris, and that was a really helpful overview. I know there's a lot of questions in the chat box. We might not get through all of them, April, today. I wonder, is there any specifically for Idris or Amanda or Lynn so far, April, that you want to pick up on? We can just pause for a couple of minutes.
I could answer a couple of those quite easily, if that helps. As I'm sure. So the quick reference guides are widely available. They're on the Scottish website, and we can send the link for that, as is other learning material that's been developed. And in NHS Highland, using the CPA meeting, so you have to be careful with near me using large groups because the capacity runs out after probably around 3 or 4, I would say, is a comfortable number. But what you can do as the clinician logging in is you can email and add participants once you're in the meeting, and that easily then links others in. So we've had, for example, me and the CPN in one location, a mental health officer in another, a patient in one, and the patient's relative in another, and that was relatively easy to set up and worked very well.
That's great. Thank you so much for answering all of those questions. That's fab. And Claire has put in the chat box some guidance around the CMS video conferencing facility as well, where there's more than 5 participants, because I know a recurring theme that we get asked a lot is around groups, for the use of groups in Near Me. So thank you for putting that in, Claire. And there is guidance on the Near Me website, which covers that point as well. Okay. We're going to move swiftly on. This is a quick fire round of everything that's happening in these areas across Scotland, so we know it's fast, but we'll give you a flavour of what's happening, and hopefully we can pick up some of the other questions at the end of the webinar. So over to Rob. Rob, you were the first. Lothian was the first area that we worked with through Healthcare Improvement Scotland to support the Near Me implementation. We've been amazed at what you've managed to achieve over the short period of time. So thank you for sharing your reflections.
Thanks. Yeah. So this was something that NHS Lothian eHealth really sort of jumped behind, which was exciting. They said, right, okay, COVID has produced these challenges. We really want to jump on Near Me. But the way they went about it was they basically sent an email to lots and lots of team leaders and managers saying, do you want video consulting? And everyone said, oh, yes, please, chocolate. Give me chocolate. I want lots of chocolate. And people were sort of asking for things perhaps they didn't fully understand or didn't have the hardware for, or actually didn't know how to answer the questions that eHealth are asking, because like many areas, mental health were perhaps either behind or on a slightly different IT system. So the first thing we actually did in Lothian was to put a big damp cloth over a lot of things and say, whoa, let's have a slightly coordinated plan to this. So what we did was we set up around 13 Near Me waiting areas for each of the main mental health specialities. And what I mean by that is we had one for adult mental health doctors and CMHT. We had one for adult mental health therapy. We had one for old age, one for forensic, one for CAMS, etc. And we created these sort of 13 areas and very quickly got clinicians logins to these, and people started using them, started becoming familiar with the technology. We didn't change anything else we did in terms of how we recorded things, how we booked appointments, how we integrated with Track, which is the system that we use. We're now, over the past month, we've gone up from nothing up to around about 100 calls a day. So it's great to see that now being used. And the next stage is going to be thinking about how we embed this into Track. So, for example, at the moment, all of the calls, people are sort of onboarded during the call. So you start off with phone and you say, look, we've got this video available. Are you able to use video? And you check it's safe and so on. And then you give the person the URL and off you go with video. But what we want to do in the future is have that URL and the guides embedded into our outpatient clinic, embedded into our waiting list, etc. So we're just beginning to explore that Track stage. But that's quite tricky because of partly how Track is set up and partly how mental health is set up on Track. So we didn't want that to get in the way. We really just got those waiting rooms and got people doing it. And as Michelle was saying, we were one of the first areas to really kick off with unscheduled care. It's been great to learn from CAMS and others up north in terms of the work they've done there, but we wanted to use this in IHTT and our home treatment team. And Lothian also hosts the National Mental Health Deaf Service, who work over a very large geographical area and rely heavily on British Sign Language, and also our art therapy team, who clearly for them phone is a major issue. So we got those teams on board very quickly, and they have absolutely loved it. They've done their own guides and videos using British Sign Language, which has been brilliant. Some of the really important things was that we got support from senior managers. The clinical leads and admin leads for these rooms, I made the senior managers in those areas. So they were actually taking ownership and driving that forward. And we've now begun slowly to think about subdividing some of those rooms and getting it down to the local team level. We also had a digital mental health team in place. When I say in place, I'm about to start doing this role half-time from June. So I'm not actually in place yet, but my role was there. We were looking forward. We had the intranet site. We had the guides. We had the support for it. People knew who I was, and we were very quickly able to sort of say, right, let's take the generic near me guidance and we'll Lothianize it and we'll mental healthize it and make sure it works in their language. And as a result, people trusted it very quickly and were able to get on board with it. We've had the same areas, I think, as anybody else, which is hardware, bandwidth, the usual story. I can get a better picture on my own personal phone on 4G than I can when I'm actually sitting in front of an NHS computer. So the bandwidth is probably one of the barriers. Hardware, I think we've found a lot of things. People have found ways around it. The fact that you can use this outside the firewall on your own personal device is really helpful. There was a security issue we picked up where the patient's name was persisting in the history, which obviously was an issue. Now we were starting to use this on people's personal devices, but that was fixed over the weekend by the National Attend Anywhere software team. So it was great to get that fixed in really quickly. And we're now looking at a business case going forward. I mean, ultimately what it boils down to is a video device for every clinician. I mean, that's where we have to be going in terms of our business case and thinking about digital first. Some of the things that helped overcoming the challenges, I think we're very clear that video is better than phone. Now, I think we're just beginning next week in Lothian to be rolling this out to some of the physical health areas, and they obviously do perhaps want to be laying hands on the patient slightly more, but you can do an awful lot on video in mental health. The mental state examination is pretty visual. There's going to be a few areas, autism assessments, maybe not quite sure how that's going to work out, where perhaps you get more of that feel from being in the room. But certainly us psychotherapists have embraced it because it is so much ahead of phone, and trying to think, well, actually, yeah, there's a few clinical scenarios where you wouldn't use video, but a lot of the time you can. And also being aware that patient choice is going to drive this. We don't necessarily have the geographical distance in the Highlands, but to go and see our chronic pain psychologist, you normally have to get 3 buses around bumpy Edinburgh roads. So actually seeing them by video is going to be a major step forward over phone or having to physically attend in person. And we are aware of the digital divide issues. We have got deprived populations, so we're just trying to monitor that. In terms of top tips, one of the things we did was all of our on-call junior doctors we put into our unscheduled care room. Now, this was a 24-hour room that we set up so in our home treatment team to use it, but we put all the junior doctors in that. And what that meant was that they were starting to use it when they were on call. They could share consultations with IHTT. And immediately through those junior doctors, we got champions more or less in every team. They were helping their own daytime teams get on board. We ran a few tutorials using Teams. I think I had 3 or 4 tutorials like Idris did, and people just dialed in and asked questions, and no question was too stupid. On the back of this, we completely digitized our CAM service. So our CAM service have been quite wedded to paper, and I've been wanting to get them more digital for a number of years. But pretty much overnight, on Tuesday, they all started recording all of their progress notes and clinical notes on track. So we've used this as a catalyst to get some other digitization work done, and we've used the same supports and things around that. And what we're now doing is we're looking at the business case going forward. How do we embed this not only over the next couple of months, but 6 months, 2 years down the line? What does it mean for mental health services to be digital first, to sort the hardware, to sort the bandwidth, to make sure we've got track fully developed, not just progress notes, but actually a full pathways and everything else on track. So we're just in the middle of writing the business case for that. I'll pause at that point. Thank you for asking me to come and speak.
Thank you very much, Rob. And I think COVID has provided a bit of a burning platform to move forward at pace with all of the digital work, and great to see the spread of that beyond the crisis teams into other areas. So I don't know if there were any specific questions for Rob, but we can maybe pick them up at the end and move over now to Tony. So Tony working in NHS Orkney. Welcome, Tony.
I think Tony was having some difficulties joining, so maybe if we move on.
We can move on to Heather.
Yeah, is that okay?
Hi, Heather. Heather, I think you may be on mute.
Hello, can you hear me now?
Yeah, we can hear you now.
Good.
Thank you.
There's my slides. Super. I am a very humble clinician who's used the system, so I guess my perspective is going to be slightly different from those that have come before. I work for NHS Lanarkshire, and that was how I was asked to join this presentation. But my main experience of using, well, I call it Attend Anywhere rather than Near Me, but I think they're probably the same thing. So I've been working in the NHS for NHS Western Isles for the last year, initially as a locum and now as a substantive part-time consultant in child and adolescent psychiatry. And so my experience comes very much from starting to work on the ground and being told, go with it. If you're going to live on the mainland and deliver a service out here, this is something to get the hang of. So my experience in Lanarkshire has just been in the last few weeks where we've been trying to get it up and running for the sort of urgent service we're providing during the current restrictions, and has been much more limited. In terms of what's worked well in the Western Isles over the last year, the main thing that I think has kind of helped it go well has been that they increased the consultant time around about the time that I started working, so that patients had a choice of either visiting me in a clinic once a month, which would have been the service provided in the past, or they could have a video call to me in between times. So they either had to wait a month or could have a video call within a week. Every single patient has chosen to go with a video call within a week. They're absolutely up for it in the Western Isles, which makes it a much easier way of working because they're meeting you kind of halfway with that. And we've had loads and loads of positive feedback from patients about having the increased hours, but also the increased accessibility of this service. There are some specific patient groups and symptoms that responded well. I think working with adolescents, they love kind of digital communication much more than going to see a doctor in a clinic. It's much more meaningful for them and kind of real. So it's actually you engage better with a teenager often through Near Me than you would do by bringing them into a clinic. So that's been really positive. Hyperactive children, it works quite well because you can see the child in the clinic and take their height, weight and blood pressure, get them out of the way, offer the parents an appointment, hopefully in the next week or two, to go through the developmental history. And that works much, much better than trying to take that level of information from families when there's a child running wild in a clinic room. So that's worked quite well. Autism spectrum disorders are not so much the assessment of them, because I think that would be quite tricky, but certainly treating people with autism spectrum disorders I found Near Me really, really helpful. Again, I think it's because people are at home, they're in an environment they feel comfortable. For people who have communication difficulties, who struggle to put their point across. I think it kind of helps to be in that kind of environment. And, I've been able to introduce kind of much more, to get to know them as individuals much better, and then be able to adjust things like CBT and so on, and kind of coping strategies towards the individual in a way that I would never have been able to do in a kind of clinic. Assessment of psychotic symptoms works quite well using Near Me. Again, my experience is that's because the patient is in a familiar environment, they're calmer, they're less guarded, and I think the power balance is maybe slightly different as well because it's a less formal setting. So they're more likely to maybe open up about some of the things that have been going on in their head. That's really helpful as an adolescent psychiatrist because a lot of their psychotic symptoms can be quite kind of vague and difficult to understand. So that connection has been really good. I put in access to pets, which is an amazing way of building a relationship with kids. That it is, you just can't do it in a clinic. But, I've had dogs, cats, and even one guinea pig join me on Attend Anywhere in recent weeks, and it works really, really well. Another thing that works quite well is that when patients come to clinics and you ask them what their medicine is, quite often they can't remember in the pressure. I think it's the pressure of the moment. Whereas actually with Attend Anywhere, they can say, oh, I don't know that. And then they run off, they get their medicine box out the cupboard, and then they show you on the screen. And you can see exactly what it is that they were talking, and you know that you're talking about the same thing. So that's been a kind of anecdotal kind of thing. One of the things that's quite difficult, I talked about in the challenges, is around the communication can be a little bit more clunky on the video calls, and making a joke is quite an important part of the mental state examination, just to see how people respond to humour. But obviously making a joke is quite a tricky thing with someone who's potentially mentally ill and of maybe a different background and so on. One of the great things about Near Me is that they have really annoying music that patients listen to whilst they're waiting to see you. And so what you can do is make a joke about the annoying music and how they're managing to cope with that. And actually, it works across the board in terms of making people smile if they're going to smile. If they're ill and not able to smile, then you can take your own psychiatric inferences from it. But that's quite good. So don't get rid of the annoying music. The other thing that's worked quite well for me is that I find it easier to do appointments using Attend Anywhere than I do in a clinic in real life, that the emotional intensity is slightly reduced, and that I've kind of put that in as the counter-transference. I don't know about the transference, the mistake on the slide there, it should say the transference in terms of how the patient responds to the doctor and what their feelings are. And I guess that would be something that would be quite interesting to talk to psychotherapists when they start using these experiences. But I see kind of usually 10 patients every Tuesday, kind of pretty much half-hour appointments back to back, and I'm nowhere near as exhausted as I would be if I'd been doing that in a kind of real-life clinic setting. So there are differences about it. I'm generally very positive about Attend Anywhere. I think it's worked really well in terms of me delivering a better service out in the Western Isles. And I think most of that has come down to the community attitude to healthcare, that the people who live in a remote area are generally very accommodating when it comes to using technology and being adaptable about getting a better health service. Lanarkshire has been different. They've been much more cautious about it, in a kind of, I get a clinic on my doorstep and that's what I want kind of thing. So I guess the population is really important. Obviously, support from management is really important. And out in the Western Isles, again, they're kind of used to using this technology for lots of different aspects of healthcare, and so it doesn't have any area of controversy around it. I've also found it personally rewarding to be working in a different way and to be learning about kind of doing, delivering a service across a kind of remote geographical area and using new technology. I'm not a technological person in any shape or form. It doesn't kind of sit easily with me, but it's a system that once you get used to it, works very smoothly, and I find it relatively straightforward. in terms of challenges, the kind of communication errors can come up. When they do come up, I tend to say them out loud and point that out, so that it's not like you're trying to hide a communication error like you might want to do in a usual social situation. I just kind of say, oops, I misunderstood you there, terribly sorry, and then blame the near me technology, which usually works a treat and is probably true as well. Missing clinical signs is the kind of next thing that I've kind of written down. Subtle signs like neglect of personal care can be quite difficult to notice. I've got a patient who bounces her leg up and down repetitively when she's agitated and becoming ill. And because I can only see the top half of her, obviously I don't know what's going on with her leg. So there are things like that you need to be a little bit maybe more aware of. I recently had to ask a patient why her hair was wet. Was it because she had just come out of the shower, or was it because it needed to be washed? Those kind of things are the kind of silly questions that I've put on in terms of explaining the information that you're getting from the video calls. Patients don't mind it at all, actually. You know, I think they'd much rather you ask that, quite honestly, kind of what's going on, and they go with it. Managing distressed patients is probably a big issue that will come up for people thinking about working in this way. And initially, when I was doing this work, the patients were being seen with a CPN in the same room as them at the time, so that the CPN could calm down any drama that I'd created. It was never needed. And now that the COVID restrictions are coming in, the CPNs are using Attend Anywhere to sort of link in to my Attend Anywhere appointments, so there are 3 screens. We haven't had any drama or disasters yet, and I think accepting that there is a risk that people will become agitated and possibly harm will be caused then has to be weighed up against the advantages of delivering a better service to large numbers of people across the population. And I'm hoping that in the event that things go wrong in the future, that will continue to be my view. But so far, a lot of my patients would have family members with them or around, so that may be slightly different when working with adults on their own as well. I put in that inability to undertake a physical examination. That's been kind of brought up before, that usually we would do height, weights and blood pressures on kids for ADHD medicine and that kind of thing, and you have to rely on GPs for filling in the gaps there. Which hasn't been a problem. Generally, if you ask nicely for things, people work together. The system not working due to slow internet speed has been a problem, partly for patients, but also for myself. In my Lanarkshire office doesn't work very well either. Works much better from home. So there are kind of things like that. There's an annoying feedback questionnaire at the end of every single consultation that you do, which would be great if we could just change that to at the end of every single clinic rather than every single patient. But obviously data is being collected and so on. But when you're busy, it is a bit of a pain. For me, access to written information has been really challenging because I'm a long way away from the service, and it is still paper-based. So we've had to kind of think about the sort of admin support and that kind of thing. And it's not perfect yet. I've changed the appointment time and frequency a little bit. Usually child psychiatrists see patients for an hour, which is a long time on a video call for these kind of purposes. Even a new patient, normally after 45 minutes or so, we've all had enough. So I tend to have sort of 30-minute appointments, but make them more frequent than the sort of hour appointments that I used to do. Again, kind of families kind of go with it, and it's about kind of being flexible there. My top tips are to remember it's just people connecting, and it's an additional tool to use to deliver a psychiatric care. That there are limitations to it, but there are also significant advantages too. I would advise expecting communication problems and delays, and having a telephone number for the patient as a backup. Sometimes the bandwidth means that you can see the screen, the picture goes, but the audio is uninterrupted, and that works okay. You can keep a consultation going. But if the audio bit gets disruptive, it's nigh on impossible to kind of work like that. So you can have a telephone call alongside the screen working sometimes, and that means that the appointment still happens and the outcome still gets sorted out. One thing that families really love is being emailed the link, so that all they have to do is open their email, click on the link, and it takes them straight into the right place that they need to go and attend anywhere, rather than going through the system where you kind of Google Western Isles attend anywhere or whatever, and it then kind of takes you in. So emailing them, which is not a usual way that we've communicated with families much in the past, is lots of positive feedback about that. I would advise scheduling breaks in between meetings and difficult appointments, although I would never quite get around to doing that for myself, but it would be a good idea, just because of the intensity means that you can end up sitting on your chair for long periods of time, which can't be good for your back or your leg muscles and that kind of thing. And I think the other things I've learned a lot about is about working from home and the kind of practicalities of working around impromptu parcel deliveries and window cleaners and children in lockdown and these kind of things as well. Getting kind of anticipating these things and getting organised also kind of helps things go a long way. But generally, I would recommend it really, really heartily.
Thank you so much, Heather. That was great, and I love hearing all your insights and to what's been working and what hasn't. I'm just really conscious of time, so we're just going to, if you've got any questions, just put them in the chat box, and the panellists will attempt to answer them in the chat box. And we're over to Tony now.
Hi, thanks for having us.
Hi, Tony.
Hi. Yeah, I suppose what I do is kind of reiterate some of the things that have already been said, and especially for the Western Isles there. I think things that have worked well for us. Contact with patients has been maintained throughout this whole thing, which has been quite good. And we've actually used Near Me from before the COVID actually came along, and we found that it's been quite well received by patients, and it kind of just continued on with us in this period where they've not been able to get in to see us. Being in the islands here as well, we have quite difficult times trying to get a hold of patients, because like a patient in a Northern Isle can take 12 hours round trip to see one patient in a day. So it's got a huge impact on how we actually provide our service. And then financially as well, it's a huge impact. But using Near Me has basically wiped those problems out completely. We're actually still able to keep good verbal insight and physical insight into how the patients are doing as well. And we find this really beneficial as well, because sometimes in the past we haven't been able to see patients. So it's been a huge help for us in that respect. It enables us to share work as well, something that we haven't been able to do with isolated patients. So you've got the facility where you can share documentation on the Near Me at the same time. And psychology as well has actually started using Near Me to do things like EMDR, which they've found works quite well. These things couldn't have ever happened for us if we hadn't had the commitment for our organisation as well. And they've worked really, really hard to make sure we've got the right equipment, the right training, and the right support as well, because we've had loads of support through our IT department. And what we did as well, one of the speakers previous had said that we have people in the teams that are going to be champions for this, and that's worked really, really well. You've got people beside you that can actually help you through with these things. So that's been really important for us to get this whole Near Me process working and maintaining contact for the patients. But it hasn't been plain sailing for us all the time, obviously, because initially in the lockdown period, we had real problems with broadband service on the islands. It really struggled to cope with that, because it's not at the best of times. So we had lots of connection problems with picture dropout, poor sound, and we actually used one of the things to overcome was to actually have the telephone on at the same time. So you're actually speaking to the patient on the telephone and using visual from the Near Me. So that worked really, really well. So we've done loads of things to overcome these things. I think being proactive was the best thing we could ever have done in the beginning. We'd already started working on this before COVID came along, so we were kind of ahead of the game as far as that went, but we were managing to keep in touch with patients really quite well. And by getting the creative IT solutions for things like using a telephone near us, it helped keep it going. One thing that we did as well is the psychology department. They have actually started including Near Me as a means of contact when they offer appointments, so that Near Me is embedded in what we're doing for patients nowadays. So when we offer them the first appointment, they've got a Near Me appointment offered at the same time. We've also gone and provided quick links onto our websites as well, so that people can access in various ways. And any top tips we have in this is being positive in the use of Near Me. I think that if we can come across as workers being positive that this is a good thing, patients are more liable to take up the whole process and go with it. Having good support for the staff and for the patients, I think, is something that's been really important for us and we've found works really, really well. In encouraging the patients all the way through the process, even when they've had a difficult session, maybe it's not worked quite as well, it's maintaining that and making sure they're still going to give it a go for the next time. And the one other thing we came across that worked really well was the use of the refresh button. So for you as a clinician and for the patient as well, if you can both use that refresh button, it actually makes the link a lot stronger and works a lot better. Okay, thank you very much.
Thank you so much, Tony, and thank you for being so succinct. I know it's not easy describing a whole service in such a short period of time. This is a link here to all the clinical summaries that have been developed, and our email address, if you would like to find out more about the work that we're doing. We will endeavour to look through the questions that have been posed on the chat box today. Many of them have been answered by the panellists, but we know there's probably a few that we still have to answer. I'm not sure if we've got any extension to the webinar time today to just pick up on a couple of questions, or
yes, go ahead.
We can. Okay, that's great. Any burning questions people would like answered on the call, and if we can just unmute everyone at this point so that if there's anything that someone has a burning question about, we can answer before we finish in the next few minutes. April, was there anything from the chat box that you think would be worth covering before we finish?
I suppose the first thing is just to let everybody know that the slides will be made available to you, and also that this WebEx has been recorded, so you'll be able to listen again. There were quite a few technical questions, and I was aware that there was some responses going back, but I think perhaps only the panellists could see these, so we will compile a list of the questions and answers and get those out to you along with the slides.
Thank you so much, April. And thank you so much to everyone for being part of today's discussion. We will send you the link afterwards to the video recording and to the slide set, and we'll also be sharing them on the Near Me website. We are continuing from a Healthcare Improvement Scotland perspective to work with eating disorder services and perinatal mental health services. So if you have services within your area who are interested in Near Me and supporting the implementation, if you can get in touch with the email address that's on the slide set at the moment, and we're happy to get in touch with teams directly around this. There is an eating disorder webinar tomorrow, so again, if you're interested in that, just drop us a message in the chat box or email us at the email address. Thank you so much for all of our presenters for giving up your time today. It's been so helpful to hear your top tips. And we'll get information out to everyone following today to share all the information shared on today's webinar. Thank you so much. It looks like there was 214 participants on today's webinar, so that just shows how much interest there is across Scotland. Thanks, everyone. Have a good day.
Thanks. Thank you, ladies and gentlemen. That concludes your call. You may now disconnect.